How can executive moms tell the difference and what can you do about it? Now, as an executive mom, you're used to handling a million things at once: your career, your family, self care, often pushing through discomfort just as you get everything done. And even when your lower back pain shows up and refuses to go away, it is not just frustrating, it can be very overwhelming. Now, it can be overwhelming when you don't know where that pain is coming from, what is causing it. Is it something that you need to address urgently? Is it something that can wait? And really, once you know what's causing the pain and all the answer to all these questions, it is such a relief mentally. And then you can sit down and chalk out a plan as to how you're going to manage that pain, or you can go to your doctor or healthcare professional and they can help you to chalk out a plan to manage that pain. But first, you need to know that the pain that you have, is it just lower back pain? Is it a sciatica pain? What is it and what can you do about it? So let's address that in today's video. Now, for those of you who don't know me, my name is Swati. I'm an executive mom power coach. I help moms of younger kids who work in high stress executive jobs to manage their spinal, that is back and neck, and nerve pain despite low energy levels and brain fog. Now, I do so by giving you simple exercises, some easy lifestyle modifications, some tips and tricks that have helped me in my own pain and adrenal fatigue journey. Now, those of you who know adrenal fatigue know there are lots of symptoms, but the two main ones that I had were low energy levels and lack of focus, or brain fog, or mommy brain as it's sometimes called. And that is why I talk about these, because once you have these, it feels, it is not impossible, but it feels next to impossible to manage your pain. So excuse me. So today going to talk about lower back pain or sciatica. How can executive moms tell the difference and what can you do about it? Now let's address the first one, that is lower back pain. Usually lower back pain or your lumbar pain tends to be more localized and persistent. It stays around your lumbar spine or your lower back area. It can sometimes border towards your bottom, but it usually will not cover the full bottom. It can just border around your SI joints, that is the joint in the pelvis between your lumbar spine and the pelvic bone. But it's okay if you don't know those terms, just remember it's your lower back area where it is localized. Can be achy, sore, or tight directly in the lower back pain. It can be a sharp shooting pain as well. Usually, back pains will be worse after long periods of sitting or standing, that is static postures. Because honestly, our bodies were not meant for prolonged static postures, but that's talk for another day. Anyway, so usually with lower back pain, unless you are in very acute pain, it feels better with stretches or gentle movements. And if it is purely back pain, it usually will not radiate to the bottom part of your buttocks or your legs. Now, what can cause it? Poor sitting, standing habits, weak core muscles, overuse injuries, lifting heavy weights. The causes can be numerous, but these are the common ones that you see without pathology. Of course, there's disc pain and stenosis, etc., but I'm talking about everyday stuff. Sciatica. Now, this is a radiating nerve pain. Sciatica happens when your sciatic nerve gets compressed or irritated in your lower back or anywhere along the course that it runs from your lumbar spine, bottom, back of the thigh, back of the leg. So it can get irritated or compressed anywhere along that pathway. Now, commonly it is seen as a sharp shooting burning pain in your lower back or your bottom, and pain that travels from the back of your leg. So it is not to the side or the front, but towards the back of your leg. So we're talking about the same route that I just described, from your bottom to your thigh to your back of leg, that is your calf muscle, etc. You may feel weakness in that leg if you've had it for a while. You may feel tingling, numbness. Pain gets worse with prolonged sitting, coughing, or sudden jerky movements where where the nerve gets irritated or compressed. So, for example, there might be a certain angle at which you are sitting, or when you get up or twist, turn around to see something, and that is when you feel that catch in the back. Now, there can be quite an overlap between the symptoms of lower back pain and sciatica, but I'm just giving you a general overview of what you can expect, and then you can make a rough estimate as to whether it's just lower back pain, is it just sciatica, is it a mix of the two, really? So, what can you do about it? Um, with sciatica and lower back pain, the mantra that I follow is be smart about it. So work smarter, not harder. So how can first thing you need to know is what exactly is the cause. Now, but for lower back pain, I would focus more on postural corrections, strengthening your core, gentle mobility exercises to reduce the stiffness. Of course, this is after the acute phase has passed and the pain has subsided a little bit, not completely. You don't have to wait for the pain to go down to zero. But when your pain has subsided, you can start working on those. I'll repeat it again: postural corrections, strengthening your core, and gentle mobility exercises to reduce the stiffness. For sciatica, you could do all of this if you have a mix of sciatica and back pain. But if it's pure sciatica, I would go for nerve glides or nerve stretches exercises. Address those muscle tightnesses, especially in the hips and glutes, and in the thigh area or the back of the leg and calves, especially if your nerve is getting pinched there. Of course, you would need to get it assessed to know exactly, but so you can sort of tell that your pain starts around the back of the thigh or into the buttocks, so you know those are the areas that you probably need those the muscles are tight and you need to address those. Proper posture and spinal alignment to reduce the nerve compression. So this is also important, especially if your sciatic nerve is getting pinched anywhere in that lumbar spine. Now, understand that you don't have to push through the pain. You need to understand your body's signals, whether it is localized back tension or radiating nerve pain, that is your sciatica. Simple, effective strategies can help you. Now, you may be, if you want, or you may be wondering what exactly can you do, because all this is talk. How do I do the core work? How do I do the nerve glides? I have a free community. I will leave a link to that in the description of this video, where I have free trainings. But free does not mean invaluable. They are quite, I mean, people have recommended to other friends as well. So you can have a look. So it has a training on simple solutions to manage your back pain, another one on nerve pain. There is one on core activation. There is one on posture. There is a lot of trainings there. So these are the fours that will be relevant to you if you have low back pain and or sciatica. But there are lots of other trainings on spinal and nerve pain. And if I was you, I would check it out. And of course, if you have any questions, any comments, do drop them in the video and I will address them for you. Alrighty.